Liver 1, Jing-Well points. Location, liver 1 on the lateral aspect of the big toe, 0.1 tune proximal and lateral to the corner of the nail. How to find liver 1 is located at the junction of two tangents along the proximal and lateral borders of the big toe, 0.1 tune from the actual margin of the nail. Spleen 1 is located at the medial corner of the big toe. Needling vertically or obliquely 0.1 to 0.2 tune. Avoid needling into the perineum. For excess conditions, prick to bleed. Caution, painful point. For the actions indications, liver 1 regulates the lower burner, the genitals and liver chi, eliminates dampness, opens the sensory orifices. Special features, liver 1 is the Jing-Well point, wood point, bend point, 5 phases, and 3 point. This point has a marked action on the lower burner. First of all, it stops uterine bleeding from heat in the blood. It would not be indicated in uterine bleeding from Qi deficiency. It resolves damp heat in the lower burner in two main areas of the urinary function and external genitalia. The liver channel has an important influence on the external genitalia, and such diseases are part of the broad group of diseases falling under the category of hernial and genitourinary disorders. Liver 1 in particular is a major point for use for hernial and genitourinary disorder. Shan is a general term for a wide variety of disorders. Traditionally, 7 types of Shan disorders were listed. This can be broadly differentiated into 3 general categories. The Concise Dictionary of Chinese Medicine lists these 3 groups as follows. First, hernial type diseases characterized by a protrusion of an organ or tissue out of the abdominal cavity. Second, diseases of the external genitalia in men and women. Third, severe abdominal pain accompanied by constipation and retention of urine or difficulty in urination. Diseases of the external genitalia mentioned among the indications above are part of the hernial and genitourinary disorder, and liver 1 can be used for enlarged scrotum, itchy scrotum, redness and swelling of the vulva, pruritus vulva, etc. Liver 1 dissolves damp heat from the urinary system and benefits urination so that it can be used for such symptoms as difficult urination, retention of urine, turbid urine, and painful urination. Finally, liver 1 restores consciousness, as many well points do, and is used in the acute stage of wind stroke. For the summary, liver 1 regulates menstruation, irregular periods, excessive uterine bleeding, prolapse of uterus. It resolves damp heat, swelling and pain of the genitalia, pain in the penis, retraction of genitals, swelling of testicles, swelling and redness of vulva, retention of urine, blood in urine, painful urination, frequent urination, difficulty urination, and turbid urine. It also promotes resuscitation for the loss of consciousness or epilepsy. According to the Song of the Jade Dragon, for the 7 types of Shan disorder, choose liver 1, while the essential question says, when the pathogen resides in the foot, it will give rise to sudden pain of Shan disorder, needle above the nail of the big toe. Shan disorder is a broad category that includes hernia, genital swelling and pain, and severe pain of the lower abdomen. The most common patterns for this disorder include stagnation of qi, accumulation of cold in the lower channel, damp heat, traumatic injury, and deficiency. Liver 1 is the Jing-Well point of the liver channel which encircles the genitals and enters the lower abdomen. It is an important point to regulate the qi in these areas and is the preeminent distal point in the treatment of any pattern of Shan disorder. But as the Jing-Well point is specially suited to the urgent condition with acute and sudden pain. Both the Yellow Emperor Inner Classic and later texts, such as the Greek Compendium of Acupuncture and Moxibustion, recommend that cross-needling be applied at liver 1. In other words, the left liver 1 is needled for right Shan disorder and vice versa.